Hi everyone, Dr. Nemechek here. I want to talk a little bit more about long COVID and the inflammation and discuss how we've already talked about how glutamine might help, but we can also talk about how studies showing that vagus nerve stimulation can help. So as we've talked about before, these lines represent, here's just short term or basic COVID where you get over it, get infected, you start having symptoms, okay? And then you'll get this blue line is inflammation. And then ultimately the inflammation will drop down, your symptoms stop, and you recover. Okay? That's what we hope everybody has when you have COVID. Long COVID, all right? Long COVID, again, same thing, infected, you get symptoms, you get a blue line here, that's the inflammation, and the blue line, and the symptoms continue and the inflammation continues. The best data we have right now is of non-hospitalized patients who are symptomatic with COVID. 1/3 are going to have symptoms for at least a year. Okay, 1/3. So, and if you've had COVID a couple times, there's a good chance you've got some symptoms from that still. And you may not feel sick, kind of maybe tired. A lot of brain fog really is the most prominent thing. It's just not thinking too clearly. Some people achy, no smell, no taste, so forth. And these symptoms are all persistent. More and more data is telling us these symptoms are all from chronic inflammation. And in my experience in using our protocol to lower inflammation, these symptoms will go away. So now, one of the things we do use is a VNS, a vagus nerve stimulator. So the vagus nerve comes down, goes through your whole body, and the vagus nerve controls, amongst many things, all inflammation. And for about 25 years now, they've been surgically implanting these in people. If you think of like a pacemaker, and instead of the wires and electricity on the heart, they put them on the vagus stimulator. They'll do these in people with severe drug-resistant epilepsy. So you're talking about people with 100, 200 seizures a day. Nothing helps. You put this thing in them and surgically implant this, and in a year or two, most of these people are in remission. Okay, they wear it. It's running 24 hours a day, years on end. Very, very safe. Now, the vagus nerve comes down and shoots a little branch out to the ear. Okay, and right here in the bowl, where like an earbud would touch, the vagus nerve is right under the surface of the skin. And so you can use, so it's called transcutaneous, and that means across the skin vagus nerve stimulation with a little clip and a tiny little current on there. And so here's a study looking at this. And so here we've got transcutaneous auricular, that means ear, vagus nerve stimulation for long COVID symptoms. And they took these patients, and they were basically, these patients had anxiety, the scores for all of these things: anxiety, depression, vertigo, which is dizziness, anosmia, that is can't smell, ageusia, that's can't taste, headaches, fatigue, irritability, and brain fog. Okay? And these patients get transcutaneous auricular vagus nerve stimulation, and they're doing it for 2 hours a day. And this is what you see. So here, this is the sham group. These are people that have a device on, because the current you use, you don't have to feel. So these people had a device. They set everything up the same. They didn't know, but their device didn't put any electricity on the clip. Okay? And so you have those people, and what this tells us is they're about the same. Here, once you start treating, okay, these are the people without VNS. They're about the same, but you have very rapid decline here in symptoms. This is symptom scores of all those symptoms I talked about while you're on VNS, okay? And then here, now open label, meaning we take these people, we turn on their VNS, look, their symptoms improve also, and these people improve, and then we stopped the treatments. Now, when you've had this for 4 weeks, what happens is you maintain that. You might even continue to improve after that, okay, after getting the VNS. If you only had it for a couple weeks, it helps, but they kind of start drifting back to their baseline. So what this tells me is you need probably at least a month's worth of VNS. We have a device here we use that we may keep people on it for 4 to 6 months, actually, if they need it to help with their COVID symptoms. And it's all part of fixing the gut with the rifaximin and glutamine. We're using fish oil and olive oil to kind of balance these omega-3 and 6s that are coming in from the food supply, and then the vagus nerve stimulator. And then patients can get off and they do better. So anyhow, we do have a device that's available without coming to the office. This, though, could only run about 5 minutes at a time, and you would have to just keep clicking it. You'd need actually an hour twice a day if you were mimicking what was in that paper. So I put reference to this paper down below in the notes section. There are some links if you're interested in just looking at the Vitality. You'll see links to the Vitality cable. And don't forget to subscribe. Other than that, everybody have a great day. Thank you.